Hello everyone. I am Dr. Poonam Guha. I am a pediatric surgeon with special interest in pediatric urology and warding problems in children. I would like to thank Neotia Bhagirathi Women and Child Care Center for having given me this opportunity to speak on the surgical aspects of urinary tract infections in children. As you have listened to the talk by Dr. Shumantara Raut on the medical aspects of urinary tract infections in children, I would again like to stress on the factor that urinary tract infections is a common problem in childhood. It is seen even in children as young as 1 year of age or even younger. So why is urinary tract infection important in childhood? First of all, in children, the kidney is in the developing phase. So any severe infection happening in the kidney during this delicate age can lead to permanent damage to some part of the kidney which results in scarring. These scars can hamper the future growth potential of the kidney, and in the long run it can cause increased blood pressure or increased protein loss in the kidneys in the urine from the kidneys, which can potentiate further renal damage. This is one reason why urinary tract infection is important in childhood. The other reason is that many of these children may have some anatomical problem or structural problem in the urinary tract which can predispose them to have repeated urinary tract infections. So what do I mean by this? The urinary tract is composed of the kidneys, the ureters, the bladder and the urethra. If the child has got some obstruction in the urinary passage, that is in the urethra, somewhere in the bladder or in the ureters, then it can cause stasis of the urine and it can cause urinary tract infections. Also, there is another entity called vesicoureteral reflux, that is, the urine is refluxing back from the bladder into the kidneys. This is a very known common factor which can cause recurrent episodes of urinary tract infection. So whenever a child is having an episode of urinary tract infection, it is important for us to diagnose whether the child is having any of such anatomical or structural factors within his urinary tract which can cause him to have several or repeated episodes of urinary tract infection. So whenever you visit your pediatrician or pediatric nephrologist after your child is having an UTI, your doctor will usually suggest a few investigations like ultrasonography of the KUB or the kidney ureter bladder to identify any of such anatomical factors. And in selected cases, your child may need specialized investigations like the micturating cystourethrogram, that is a special X-ray, or some scans like DMSA scan. So by these tests, we are trying to identify any such anatomical factors which are there in the urinary tract which can cause repeated episodes of UTI. If any of these factors are present, then they may need surgical correction. So whenever I speak of surgery, it usually rings an alarm in our heads. We all think that the kid is so small, my child is so delicate, so small, can he undergo surgery? Can we wait for a few years after that the surgery can be done? So the answer is, if there is any lesion or any abnormality in the urinary tract which has caused one UTI, it can very well cause several more UTIs and can cause permanent damage to the kidney. So it's always better to get it repaired or corrected at the earliest most stage. And I can assure you that with the current surgical and anesthetic facilities, we are very comfortable even when we are operating on a 1-day-old baby. So there is another group of children I would like to talk about in whom the child is having repeated episodes of UTI, but all the other reports are coming as normal. Or other reports like USG and MCU are coming as normal. Everybody is perplexed. Why is the child having UTIs? Many times, if we check the history carefully, the child may be having symptoms like he's having to visit the washroom very frequently, he's passing urine frequently, he's leaking a few drops of urine before he reaches the washroom, his underpants are wet, or he's having bedwetting till a very old age. So these may be factors which show that the bladder is probably not behaving properly and which is causing the UTIs. So if this child is properly evaluated, then the cause of UTI can be identified, bladder can be managed, the symptoms can be improved and the UTIs can be reduced. So just to summarize, UTIs in children are not to be taken lightly. They are very important things. They can cause permanent damage to the kidney, they need proper evaluation, and if any cause is found, they have to be managed in time. It's our job to keep the kidneys of our babies safe and healthy. Thank you.